Hello again. Welcome to the guided lecture. This is Mr. Naughton. Today we're continuing our unit on addictions, focusing on alcohol. Today we'll be talking about three different issues: effects and consequences associated with using alcohol, what is alcoholism, and risk factors for alcoholism. So here we go. So we mentioned some of this stuff before about the immediate sensory and physiological effects on consuming alcohol, like slurred speech, dull sensations, blurred vision, less dreaming time, loss of body heat, kidneys producing more urine, and liver working too much to break down the effects and the alcohol in the system to remove it. We also discussed some long-term diseases and damage due to alcohol use. Brain damage, most associated with memory and learning damage, liver damage, cirrhosis, cancers, heart disease, high blood pressure, blockages, and digestive problems. We could have different types of cancers in the mouth, in the esophagus, in the tongue, and in the stomach. Also, drinking and consuming alcohol can lead to ulcers, heartburn, indigestion, and diarrhea. Just a number of things issues that drinking alcohol, not even just in excess, but just drinking alcohol in general, can cause. Along with drinking alcohol, with the physical and the auditorial and sensory and physiological effects, there are also like emotional effects and effects on other people. Not just with alcoholism, but with drinking and problem drinking and partying as well. With alcohol can come unpredictable behaviors that could tend to be not like somebody. Embarrassments could happen. People can consume too much alcohol, and they can do something to embarrass themselves or to embarrass their families or their status. Violence can occur. The violence is closely associated and linked to alcohol abuse and alcohol consumption. Becoming addicted to alcohol or spending too much money on alcohol can lead to financial problems. Getting caught with alcohol underage, getting DUIs, DWIs, getting into fights. A lot of these things can lead to legal problems. Legal problems can also lead to financial problems as well. Alcohol has been linked to divorces where families are broken up, families are split up, and a whole family can be affected from consuming alcohol and alcoholics and alcoholism. So, some social implications of using alcohol. Alcohol smells bad. It will be on your breath, and it remains on your breath. And people can tell that you were consuming alcohol, that you were drinking. It's not a pleasant smell, especially if you're close to somebody. Alcohol causes clumsiness, where you could be staggering or falling over yourself. Not a very good look, and could be easily embarrassed. Alcohol can cause an easier engagement in risky behaviors. So you might do something that you normally would not do by being under the influence of alcohol. Too much drinking of alcohol can cause vomiting or blackouts, or possibly even being passed out. Being passed out at a party or being passed out somewhere where you're not safe could make you vulnerable to a lot of different things. And a night after drinking or whatever, consuming alcohol can cause hangovers, which can lead to more dysfunction throughout the next day or throughout the days after. So when you think about it, these social implications, they don't make you the life of the party. They kind of make you the joke of the party when you're consuming alcohol. We talked about alcohol and the influence of alcohol with the frontal lobe, and it is found that 80% of all teen pregnancies occur when the frontal lobe is under the influence of drugs or alcohol. There shouldn't be a question mark there. There should be an exclamation point. So I'll fix that later. But that should just give you an idea of the choices that teenagers are making associated with using drugs and alcohol, like having sexual intercourse with multiple partners or unprotected sexual intercourse. that is the risky behavior that they are engaging in while drinking or being under the influence of drugs or alcohol. We talked a little bit about this already, the legal consequences for teens, and you researched this the other day. Zero tolerance law, anyone under the age of 21. Unlawful consumption or possession can result in suspension of driver's license, fines, prison time. Driving under the influence can result in suspension of driver's license, fines, and prison time as well. And use of a false ID you can actually have a fine up to $25,000 or 3 years in jail. So as you look over these results and these potential punishments for either consuming or having possession or driving under the influence, you need to know that there's a reason why this law is put into place. You've researched it, why 21 is the legal drinking limit. So you need to understand and identify that as an opportunity to be alcohol free until you're old enough to make your own choices at the age of 21, which is the legal age that they have placed for you at the moment. Also, not just legal consequences, District 214 has their own consequences, so your school and your district also has their own consequences, such as being suspended from school activities or co-curriculars like a sport or an activity or something, and also being suspended from school and from class. And if matters get worse, the district can actually put upon for someone to enter rehabilitation programs for them to even be allowed back into the township high school district 214. So just something to remember, that it's you're not just putting your life at risk, or you're not just putting jail time or fines or taking away a driver's license. You can also be potentially taking away your schooling, and a lot of different things are at risk when you are under 21 and you are consuming alcohol. Alcohol use can result in a permanent disability, a death, or permanent disfigurement. I'm going to share this YouTube clip with you, and it's a pretty horrendous and horrific story about this young female who was almost killed by a drunk driver, and the aftermath of her living just barely and coming to terms with living with a horrible disfigurement after this accident. So I would place some emphasis on watching that video, and maybe we'll even watch it sometime in class next week before Thanksgiving break. So what is alcoholism? Well, alcoholism is defined as a chronic, progressive, and potentially fatal disease where someone is addicted to alcohol. At first, they build up a tolerance, which means they need more and more to feel the similar effect. They then get physical dependence on it, where they need it to feel normal. They also get the chemical dependence on it as well. They become addicted, and then it could lead to organ damage, like especially to the liver, to the brain, to the kidneys, and to the rest of the digestive system as well. So when we're looking at potential people who could be considered alcoholics, you're considered to have a drinking problem if any of these 5 things are true. So 3 out of the 5 have to be true. If you have a loss of control over drinking habits, if you are increasing your tolerance of drinking alcohol, if you continue to drink despite problems that it causes, if you spend a great deal of time either getting alcohol, drinking it, or recovering from its effects, and after you stopped drinking alcohol, if you're having withdrawal symptoms like anxiety or increased blood pressure or seizures. If any of these 3 out of 5 things are true, then there is a great chance that the person is dealing with a drinking problem and could potentially be an alcoholic. So a person is dependent on alcoholic by the TACE test if they answer yes to 2 or more of these 4 questions. Does it take more than 3 drinks to make them feel high or make them feel the effects of alcohol? Have ever been annoyed by people's criticism of drinking? That would be a form of denial. Are you trying to cut down on drinking? Do people feel, is the person feeling guilty about their drinking? Have they ever used alcohol as an eye-opener in the morning, like just to feel normal waking up in the morning? That is a sign of a physical and even a chemical dependence. So, which one of these could, we're going to take you through three different scenarios, and we'll talk about which one of these three could be considered an alcoholic. Sally, who binge drinks twice a month at the Gourmet Club. John, who drinks 3 beers a day but never has any other form of alcohol. Or Joe. He drinks every weekend but never during the week. I'll give you. You can pause the video and you can think about it. You can turn to a friend and turn to a pod member and say who could be an alcoholic, and let's and just think about it. So, in fact, as we're moving on, all of them or any of them could be considered an alcoholic, because alcoholics do not have to drink every day. They may drink only one particular portion of a certain type of alcohol. It doesn't have to just be multiple types of alcohol. It doesn't matter if a person is only doing it on the weekends, or only has a few every single day, or only binges a couple times a month. If they are circling their calendars, if they're making plans to do it, if they are revolving their life around it, then they could be considered alcoholics or having an alcohol problem. So some risk factors for alcoholism include heredity. Alcoholism is 4 to 5 times more common in children of alcoholic parents as compared to non-alcoholic parents. And those with a naturally high tolerance for alcohol are at higher risk for alcoholism as well. So sometimes people are born with a naturally higher tolerance for alcohol. So if they do start drinking alcohol, they find it takes them a little more alcoholic drinks to feel similar effects as other people do. They are actually at a higher risk to being alcoholic because of the amount that they're consuming. So that's something to take in. The environment also plays a role in a risk factor for being an alcoholic. Parents and guardians teach behaviors. They teach behaviors by their words and by their actions. So if parents are drinking, or the parents say that they don't care if their kids are drinking, or they allow the kids to have parties at their house or go out to parties, or they encourage them to be drinking, then the environment is a big risk factor for alcoholism. And also the availability of alcohol at an early age. Sometimes it's due to a religion. Sometimes it's due to a culture. There are different cultures out there and different religions out there that introduce alcohol to kids at an earlier age, and sometimes it's not frowned upon in certain cultures and in certain family aspects, and sometimes it's almost welcomed. Age also plays a huge role in becoming a risk factor for becoming an alcoholic. Adolescence, your brain is still developing, so if an adolescent starts to drink, it can be quicker to become addicted. They can become more strongly addicted than if they started drinking when their brain was actually fully developed. And you could be addicted to alcohol in as little as 2 to 6 months of starting to drink alcohol. Also, stress. Alcohol is sometimes used to relax someone or be a stress release. A lot of people will say that that alcohol is an opportunity for them to relieve their stress after a tough day, or after a tough job. So that could be a risk factor for alcoholism as well. It could be used to escape feelings. They're feeling sad. They're feeling vulnerable. So they start drinking because they've either heard from people, they want to try something to escape from their own feelings, like if they're dealing with a personal loss or some type of depression. So all of these things, stress, environment, family, and age, play a huge role in the risk factors for alcoholism. You need to be aware of the risk factors. You need to make sure that you identify these risk factors as potential harmful things that could happen if alcohol is an option. So that is all we have for you today. The code word for today, which you're going to have to remember for the next time we have class, is Geronimo. So Geronimo is the code word. We will see you next time. This is Mr. Naughton signing out. Thanks for listening.